Hi, this is Emilia Banse, psychiatric nurse practitioner. In this piece, we're going to touch on PTSD or post-traumatic stress disorder. Again, like in most of my videos, I don't give you just the definition and the diagnostics criteria. I try to kind of give you a perspective from a clinician's and from my experience as to how I see these conditions presented in a real person in the real world. So nobody ever fits criteria fully, and often with any psychiatric condition, there's a cluster of conditions that a person may have, so not just one condition. But PTSD is a pretty complex psychiatric condition because it mimics and presents very often as other conditions. So I have seen in practice people with PTSD being diagnosed with very often with bipolar disorder, but with careful history taking and really pinpointing the different symptoms and how they happen and how they present and what are the different patterns of the symptom presentation helps you really kind of differentiate what is really going on. So somebody with post-traumatic stress disorder obviously would have had some type of trauma in their life. So the most common trauma we think of is usually military combat. However, most of the population has never been in combat, but you have other more subtle traumas, and you have more significant traumas, obviously, such as sexual or physical abuse, rape, car accidents, any major illnesses that cause significant psychological distress and fear. So all of those do qualify as trauma. And as more recently, the coronavirus pandemic can also be considered as a very traumatic experience for a lot of people today who have been either affected or not even affected, but just, we're all affected, but just that fear of being affected by something very traumatic and dangerous is traumatizing. So people with PTSD often have a cluster of symptoms, which include depression. They suffer with major depressive disorder, like recurrent depression. Anxiety is a very common, is part of PTSD. So overthinking, worrying, being easily startled, like that physical tension and anxiety that a person has very often with PTSD is that discomfort, that being hypervigilant, very sensitive to any environmental noises or anything that's going on around you. Having flashbacks, those are more severe symptoms, nightmares that relate to the trauma, withdrawal, social withdrawal, and emotional numbing are very, very common with this particular condition. Attention problems and concentration problems. So very often people with PTSD can meet criteria for ADHD. However, the main underlying issue is this, the result of trauma and the psychological response that person experienced. So treatment for PTSD is multidisciplinary and involves therapy, like with any other condition, medication management. So you treat the symptoms with medication. So depression, anxiety, sleep disorders, insomnia, nightmares. There are meds that can address all those things. Of course, healthy diet, exercise, proper social support, just general overall good healthy living is the best solution really for any condition, including PTSD. So thank you.